This is still exercise 13. This is dealing with the muscles for the head, the neck, and the trunk. Remember, you need to know the muscles, you need to know the point of origin, the point of insertion, and the type of movement. Once again, as I've said with the muscles of the arms and the legs, if you learn the location of the muscle first, the other information is going to all kind of fall into place as to where the attachment points are, and then from there, if that muscle contracts, what type of movement will you get? The muscles of the head are divided into different groups in terms of what type of movement do they allow for. Is it for facial expressions? Is it for chewing? Is it for moving the eyes? Is it for moving the tongue? Is it muscles of the pharynx that help with swallowing? So the muscles of facial expression, they're usually located deep to the skin on the face, the neck, and the scalp. Most will originate on the bone and insert into the skin. So that's why you see the movement of the skin. The occipital frontalis, the frontal belly of this raises the eyebrows and kind of wrinkles that forehead. The occipital belly is going to pull the scalp back and kind of wrinkles the skin on the posterior side of the neck. Orbicularis oculi, this is going to close the eyelid. When you're squinting or when you're blinking, this will be the muscle involved. The orbicularis oris is that circular muscle that helps to close the mouth and protrudes the lips when you're speaking, whistling, or kissing. The buccinator is going to compress the cheek while you're blowing or whistling. Zygomaticus raises that upper lip in the lateral corner of the mouth for smiling. So hopefully that's one that's used a lot. Depressor angula oris depresses the angle of the mouth, pulls it down. Platysma tenses the skin of the neck and lowers the mandible. Now for chewing, which is what mastication is, there's actually 4 muscles involved. You only have to know 2 of them. They do, with chewing, obviously that means moving the mandible. They're going to be involved with the temporal mandibular joint, which is commonly referred to as TMJ. It's going to help to raise or elevate the mandible, depress it, protract it, and retract it for all of those chewing motions. The masseter is going to help elevate that mandible to close the jaw. It also helps to protrude the mandible. The temporalis elevates the mandible to close the jaw as well and pulls it back. Sternocleidomastoid mastoid. This muscle is involved with flexion and the lateral flexion of the neck. It's going to help rotate the head so you can turn that face kind of upward into the opposite side. If we move on to the muscles of the neck and trunk, the trapezius is going to be moving the scapula. It helps to elevate it, retract it, and then depress it. The levator scapula raises that scapula up. It's going to rotate it inferiorly, like when you shrug. That's going to be the muscle involved. Pectoralis major is involved with several motions such as flexion, medial rotation, and adduction of the arm. The pectoralis minor, which is located deep to it, is involved with depression and the inferior rotation of the scapula. The serratus anterior is going to be involved with protraction in the superior rotation of the scapula. It helps to hold that scapula against the thoracic wall. So it's helping to hold it in place. The deltoid is a rather large muscle. It's a prime mover for shoulder abduction. It's also going to be assisting in flexion, extension, rotation, and adduction. The teres major is involved with extension, adduction, and medial rotation of the arm. The latissimus dorsi is the prime mover of the arm extension. It helps to adduct and medial rotate the arm. The rhomboids will help to elevate the scapula. It's going to work with the pectoralis minor. It helps to retract the scapula. You have the intercostal muscles. You have the external and internal intercostals. The external intercostals are involved with inspiration. So when you inhale, it's going to help push that rib cage up, increasing the volume of the thoracic cage. And then the internal intercostals are going to be involved when you exhale. It's going to move that rib cage back down, decreasing the volume. The rotator cuff is a term it's used for a group of muscles that all act together in combination to help stabilize the shoulder. The muscles that are included with the rotator cuff are the subscapularis, the supraspinatus, infraspinatus, and the teres minor. So the subscapularis is involved with adduction and medial rotation of the arm. It helps to stabilize that shoulder. The supraspinatus is for abduction and stabilizes the shoulder once again. Infraspinatus is for rotation, lateral rotation of the arm. On all of these are stabilizing that shoulder. And the teres minor is also for lateral rotation of the arm. When we move down to the abdominal muscles, you have the rectus abdominis. This is involved with flexion of the vertebral column, helps to stabilize the pelvis when you're walking. It also can play a role with forced exhaling. The external obliques, you're going to notice we kind of go in layers. External obliques are superficial. They're involved with rotation and lateral flexion of the trunk. They also will assist with forced exhaling. The internal obliques are for rotation and lateral flexion of the trunk. Notice the direction at which the muscle fibers are moving. It is an opposite direction from the external obliques. This is keeping the or adding strength to the whole abdominal area. And then deeper to the internal obliques, you now have the transversus abdominis. And now notice once again different pattern of the direction of the muscle fibers themselves.